Patients in the second wave are sicker than they were in the first wave because the numbers in hospital and intensive care are higher. Coming back to a time of fear, we hired the investigator during SARS in 2003 to look at what happened in the first wave. And his title of his book, and it's literally a book, it's 260 pages. A Time of Fear, How Canada Failed Healthcare Workers and Mismanaged COVID-19. As of last Thursday, we met again with Dr. Tam, who's the National Chief Medical Officer. What are you going to do? We need the precaution. Next slide, I should say. We need the precautionary principle. Why do we need the precautionary principle? Look at these numbers. 20% of healthcare workers in our safe country have been affected, are part of the COVID positive case. 20%. When you look at Asia, it's about 4%. So we're doing something wrong, and nobody can disagree with us. Then I asked our team to put these two pictures. Look at the what I call the moon suits of what nurses are wearing in Asia, and look at the suit what nurses are working. And that's a true picture that nurses in Ontario took when they were running out of PPE. So when you hear Debbie pushing the buttons of the health minister, let's make sure we have enough supplies, that's the reason. We need to go further. Next slide. We recognized in 2003 that we had to do something on occupational health and safety. And we all have ourselves to look at also. As nurses unions, we haven't been the strongest we have in the last 2 decades, but before that, it was a lot on professional practice, on patient safety. We were almost, thinking we're angels of mercies. We won't be hurt. We had to change that. 2003 with ONA, the Ontario Nurses Association, we've changed it. We really put safety first. But it was a big triumph, and it's still a big hill to climb, because we had 2009 H1N1, and then we had Ebola short after that. We thought we had the precautionary principle there, but we have more to do. Next slide. I don't need to talk much about the precautionary principle. This is a picture of Justice Campbell, who became the icon around the precautionary principle, which just means when you're not 150% sure on how a bacteria, a virus is transmitted, you use the best protection possible, which means airborne, aerosolized, droplets. You have to go there. So that's why CFNU and RNU have been talking about airborne protection, which is the N95 or higher, not lower, higher. And when we're going to be sure on how this virus is transmitted, we're going to reduce our recommendation. But right now, we're not reducing our recommendation. Next slide, please. The debate, and we thought the debate was going to be settled on November 3rd when Dr. Tam, Canada's Chief Medical Officer, said the COVID-19 was transmitted through aerosolized, which is small particle. Still, we're waiting for new guidance. But it's the debate of which mask, or the respirator and the surgical mask. It shouldn't be that. But it's that debate. And as I often say, it's the debate of the size of the spit. And we need to change that and really push it. Next slide. We know, and you'll read, if you have a chance to read the report, it came out October 6th. If you had a chance to read the report, you'll see that throughout we failed our first wave, and hopefully on the second wave and the third wave, if you look the science, we're going to be hitting another wave. We need to move that. Next slide. I'll just go through quickly the recommendation. The first recommendation is the precautionary principle, and we won't move from that. I'll also mention to you that we got about 30 scientists from around the world signing on to the Mario Possami, the investigator of Time of Fear. and the recommendations, signing on to these recommendations. So we're not alone in the world. Next slide. Is repeating, we need to bring the strength of the occupational health and safety in healthcare. Next slide, please. I think we're there. NIOSH. So in the United States, they have the National Institute for Occupational Safety and Health. We're asking Canada that they need to establish an arm's length from the Public Health Agency of Canada, which the Public Health Agency of Canada's role, and they're doing a great job, is protecting the public. We need an arm of experts in occupational health and safety to protect workers, to protect healthcare workers, to protect workers that work into a pandemic, that works within healthcare. So we need that, and that's one of the recommendations. Next slide is about supply and demand. Again, you heard Minister Haggie this morning, you heard Debbie, and Debbie has been on the supply and demand questions since day one, since March, since none of us were even questioning, would we run out of PPEs? Debbie was on it with the minister and the team and kept on with CFNU to make sure that we kept the supply and demand out there, and it is. You've seen the federal government pour in millions of dollars into PPEs. What the federal government tells us is there's enough PPEs out there. Provinces and territories just need to be asking for the funding and for the PPEs to go to the right place. And the right place is for nurses, for healthcare workers that take care of COVID-19 patients, or presume. And of course, we've been working with the federal government that the supply comes a Canadian-made supply to make sure we don't run in the future. Next slide. We have to remind ourselves that it is all about our lives. It's all about being safe. And you'll see in this recommendation on the public health. Next slide. Don't want to go over my 20 minutes. Next slide is about transparency. We're asking all provincial, territorial, federal government that the chief medical officer of the province or country reports back to the public on what they have done to protect healthcare workers, to protect workers in general. They've been very good at protecting the public and reporting that, but we need more accountability there. Next slide. As I mentioned earlier, it's all about the occupational health and safety and bringing that science to the table, which we're not seeing in Canada. And we're working very hard. As I mentioned earlier, we had a meeting with Dr. Tam just last week and her team of scientists to say the two needs to match. It cannot just be the science from a textbook or a lab. It has to be the workplace science so both can be safe. And we're working on that. Next slide. The numbers of healthcare workers. It is embarrassing in a country, in a country that we're very well versed on data, that we cannot tell when a healthcare worker is being infected, when he or she's been hospitalized in intensive care or died. We cannot tell where they're from, which union, which for you might not be a big issue, but for the unions, a big issue to give support to their communities, their teamworks, and their families. But we can't do that in Canada. And that's a disrespect to the healthcare workforce, because a lot of you would have watched the news when there's a big industrial accident happens either across the road or a train crash, you know exactly how many workers were injured, how many are in hospital, how many are critical, when they're out of critical. And then when the family or themselves get permission, the names are out. Well, in healthcare, we don't see that. And this recommendation is going back to the basic that a worker is a worker and has a right to safety and occupational health and safety, and their representative, which are us as unions, have a right to know when they're injured. Next slide. My PPE champions. Well, there's one of my PPE champions. I tried to think of what else have we talked since January other than PPE, occupational health and safety, because Debbie knows that if she's not out there defending and making sure that nurses nurse practitioners, and all the healthcare workforce and the essential workers are not safe, we won't be there. So again, I applaud, I thank you. Next slide. Another picture of my champion here. That is an interesting picture. That's Debbie in San Francisco. We attended a global nurses meeting, but we were fighting for Medicare for all, where, the US is in a tremendous mess with COVID, and they don't even have a public healthcare system like we do. So if they catch COVID, they have no idea. So I was so proud to stand with Debbie at one of the rallies for Medicare for all. Next slide. Seniors. We are joining the Canadian Labour Congress. You heard Brother Hassan earlier. We're asking for standards in long-term care and funding. We had Debbie and I and Yvette had a meeting with your Minister of Health, who was representing your brand new Premier just last week. And we talked about federal health transfers. We talked about seniors care. What the minister was saying, yes, seniors care, standards in long-term care, Pharmacare are all important, but we have to make sure the federal money works on it, and we will work on it. As we say, there's a nonsense when you can go deliver a baby in a hospital and be under the Canada Health Act, but when you're a senior in a long-term care facility, and not as much in your province, but it exists in a lot of other provinces, profit of that long-term care facility takes priority over care, and we have to stop that in this country. Next slide. What we've done in the last 10 months now, we've talked a lot about COVID, but we've talked a lot about seniors care. And we will continue. There's a report trying to be built now by unions who work in long-term care. I want to congratulate Ontario. They passed long-term care hours, which is a minimum of 4 hours of care per resident per day. And that is good. Now we have to work with them to make sure there's a minimum of 20 to 25% of RN care, 40% or more of LPN care, and then personal care workers. We also have to work with that province that has to come now, not in 2024 as they prescribe. Next slide. There's a basket of things that CFNU is working on, and one is a national Pharmacare program. And if you see your Minister of Health or your brand new Premier, make sure to remind them that you appreciate. They have continued to be the champions in Canada for a national Pharmacare program, and I repeat it all the time. We need more champions, and we believe the Atlantic Caucus of Premiers and Ministers of Health are going to be those champions. So quite proud of that. Next slide. We also released in July the mental health disorder symptoms among nurses in Canada. Scary. We received that report. It was in December, and then we were ready to release it in February. COVID hit. We couldn't release it. We couldn't wait much longer because this is all pre-COVID. Next slide. Look at the numbers. Major depression. 36% of nurses have symptoms of major depression, which the general public is about 8%. Big difference. The other blue line is personal security staff, police officers, paramedic, military, and look, we're higher than them. If you look at PTSD, we're at 23%. And the general public is at 8%. Anxiety disorder or panic disorder, we're at 20%, and the general public is at 20%. Again, that is pre-COVID. You will see today we're releasing 4 different studies we're supporting from 4 different universities, including Stat Canada, on the healthcare workforce, the stress that we're living today. So it's quite important that you fill those questionnaires when you see them online, etc., to build what is our mental health status during COVID. We can just imagine. Next slide. Just to make sure that we're giving you the tools, we've signed on, CFNU has signed on with Health Canada into a partnership with Wellness Together Canada. It's 24/7, no fees, it's confidential. You can do online consultation, you can do on-phone consultation, you have urgent lines. And when our board saw the presentation in early October, we were wow, we have to say, because it has organizations like Kids Helplines, it has organizations like Homewood that are all working together to help you and your families, because we're all in this together. But let's remember, the worst people to ask for help are nurses. So please, during this time, there's help out there. You heard Debbie and your Minister of Health to talk about the AAP lines that exist in your programs. This is another help, and we need to be there for each other, but ask for help. Next slide. We had a few success in last year. One was the big historical win of the Canby case, which was protecting the Canada Health Act, which means not to privatize our healthcare system. We're very pleased of that. We're working with different groups on the social determinants of health, from poverty to a fair wage. You heard Mary Shortall talk about it. You heard Debbie talked about it. Again, I mentioned Pharmacare, but it's important to continue our regular battles because life continues. There will be an end to COVID. Even Dr. Tam last night did an interview on CBC, and she said there will be an end to a pandemic. We just need to be ready at that end, and we can't stop all our fights in between. Next slide. To probably my biggest disappointment, the CFNU convention will go virtual next June. We don't have a date yet because we have to wait till the CLC sets their date, so we're not all in the same week. But hopefully we'll do as good as well as RNU. And more details will be coming on this next early December, around December 18th. So we'll try to make it as fun, but we've made the safe decision to have our convention virtually. Next slide. 31 days to Christmas. That's all. Think about that. Focus on positive things. Next slide. There. Merci, thank you, Megwish.
Thank you very much, Linda. As always, Linda inspires and motivates us to keep working, and there's no doubt still lots of work to be done. COVID certainly is top of mind for everyone, especially with the increase in numbers right across the country, and our province is no different because our numbers are going up as well. And we've seen, tighter restrictions being put in place in an effort to minimize transmission. And CFNU has been there and leading the charge at the national level for nurses right across this country. And I want to thank Linda for the tremendous work that she has done with the, with people in Ottawa, let's say, who sometimes, I don't know, I want to say something bad. They got their head somewhere, in the sand, right? They got their heads in the sand, right. Especially as we've come through SARS and all the lessons we learned from that and the precautionary principle. I know it's been frustrating here at our level, but Linda's been leading the charge at the national level, of course, which the provinces are all looking towards, and I know she must be at times pulling her hair out, trying to get leaders to put workers first and go by the precautionary principle. I'm excited, Linda, that I'm retiring, and I'm also excited that Yvette Coffey is going to take my place at the National Executive Board table, and I'm confident that Yvette will bring the views of registered nurses and nurse practitioners of Newfoundland and Labrador to that national table. Because she does it quite effectively already, and she's chomping at the bit to be able to join CFNU and the decision-making and the advocacy work that is ahead, not just on COVID, but so many other files that we're fighting to improve healthcare and the quality of care and the work lives of our members. So thank you for joining us today. It's been great that we could have you Zoom in. It's too bad you're not here in person, but we're making the best of all of it, right? Bye.
Okay, I'll wish you a great evening tonight. Virtual hug, everyone. Hug yourself. Stay safe.
Thanks, Linda.